For the past 39 years, I've been a very active handball player. It's kind of a niche sport, and there's not a lot of people who play it. But in any city, and it used to be very popular in the military, and of course in any city there's a group of individuals who play, and I've played essentially 3 times a week for the past 39 years. Previously, I was a big runner, triathlete. I've always been involved in sports. In 2006, I was participating in a handball match and injured my right knee. I knew immediately when I injured it that I had torn my meniscus. I knew that I was really looking at some type of a replacement procedure. I was very familiar with partial knee replacements that are out on the market that were made by other vendors, and oftentimes it involved taking an implant that was designed for the medial aspect of the knee and turning it around and using it on the lateral side of the knee. Well, knowing that the anatomy of the lateral side of the knee is entirely different from the medial side of the knee, I started doing more and more research, and finally came across the ConforMIS knee. I was certainly aware of the European studies where they'd studied partial knee replacements and had 17, 18, 20-year follow-ups, with excellent results, and started really looking into the ConforMIS product. It was at that time I decided to take a trip up to Boston and observe Dr. Wolfgang Fitz perform the procedures. I was so impressed when I watched the procedure done and was able to talk to some of the engineers that I said, I'm going to come to Boston and have my own knee done. So I talked to Dr. Fitz, and he agreed to do my knee, and I made a separate trip up there and had my lateral side of my knee replaced. Of course, I went through the preoperative CT scanning and waited until the implant was constructed. Postoperatively, immediately on post-op day 1. I did not require really even a walker or a cane. The physical therapist came into the room, said that she had to come and clear me. I showed her that I could basically do almost a one-legged squat, which I could not even do before the surgery because it was too painful. And was discharged on, I guess, post-op day 2, flew back here to Newport News. The next day I went outside on my outside bike and rode about 5 miles. And since that time, my knee has done great. I've never done any formal physical therapy. Of course, I work in a building where we have physical therapists that I can talk to all the time. I've basically spent a lot of time building up my quads. I've gotten my range of motion back. And then at the 6-week mark following my surgery, I finally went back and started playing handball.